It's CommonWell TV 2021 right here from our Orlando studios, where we're introducing you to some of our CommonWell Health Alliance members, but also some of our CommonWell family. And with that being said, let's go now and hear from our Executive Director, Paul Wilder. And Paul, obviously the past 18 months has been a challenge across all industries, but for health IT, how really has the pandemic really shifted the landscape?
Yeah, well, I think before COVID, we had significant strides in getting adoption going, getting more providers, getting more document usage. Right at the beginning of COVID, we saw a drop. I mean, it makes sense. There was less people seeking healthcare due to hospitals being closed, just servicing COVID patients. Right after skyrocketed. And what we saw is actually during COVID, more and more usage happening, and got a lot of feedback from providers that found CommonWell and the frameworks we connected to be invaluable to service even COVID patients. The earlier comorbidities to know how to triage, what level, the likelihood of putting someone on a ventilator, supply management, everything. So I think we're kind of sticking the win here. We're seeing that the growth that we saw during COVID is continuing, both in provider adoption, number of patients, links, and record exchange going around the country.
Paul, what was CommonWell's reaction to the ONC info blocking regulation?
Well, interestingly, we're philosophically directly aligned with it. I feel that the ONC regulation is kind of like the nail in the coffin at the end when you've already done a lot of the nailing, right? This is we've already been supporting interoperability for nearly a decade now, approaching a decade. Believe in this story, believe in patient access rights as well. So I think this helps catch the industry up to where the membership, the Alliance membership, kind of already philosophically was. And we have some work to do too in terms of patient matching and getting more providers to adopt alternate use cases or optional use cases. But this really did accelerate the conversation on those extra things, going past treatment and all the administrative uses of clinical data, like sharing with payers and getting data to patients that want to look at their data and be able to better manage their own care.
So, Paul, a report came out during the pandemic that asserted that commonly up to 50% of laboratory reports submitted to public health can lack patient address or zip code. So could you expound on how CommonWell is pretty well positioned to tackle that?
Yeah, I mean, I was actually part of the group that was writing some of that information. There was a Duke Margolis Center put out a report on this, and actually highlighting that it's almost a tragedy, right? But there are resources, there are HIEs, things like CommonWell to resource to try and help fill in some gaps. I'll be honest, if that data is missing, the job of interoperability is a lot harder in many ways because we're absent a national identifier for healthcare. And we all know this in healthcare and fight it every day. The good news is in healthcare, if the data is wrong, if it's completely missing, we have a problem. If there's no zip code at all, actually a bunch of data is rejected. And I think that's a realization that people didn't know, that many interoperability systems are looking for a minimum set of data to allow it to flow through, and then they start looking to match this stuff. So it did highlight to our providers and our members to educate on the importance of demographic information. But also the way we work is a little less automated than some other systems out there. Many systems try and take this data and match it up with computer algorithms. And algorithms are only as good as the last thing you remember or the last thing you programmed into it. Very much like building a house, right? They change codes and they change where you put the fire alarms and the heat sensors based on the last house that had a problem and burnt down. And that's not a great way to learn. So fortunately, at least we did get something during the process. We realized we had to fix this. And so we started seeing more of their data get entered more accurately, so we could do better matching and provide better care to individuals.
He's the Executive Director of CommonWell. And for more information on membership, along with all of our members, we invite you to log on to commonwealthhealthalliance.org. Paul, as always, so good to see you. Thank you so much.
Great, thank you.
Thanks for watching this episode of CommonWell TV. To get the latest news and updates, follow CommonWell on Twitter. We also encourage you to subscribe to our CommonWell YouTube channel and hit the bell icon to receive notifications when a new episode is posted.